Good afternoon. Thank you all for coming. We appreciate your time today. To move right into our Tulsa County update, today we are reporting an additional 117 Tulsa County residents who have tested positive for COVID-19. Brings us to a cumulative total of 12,831 people who have tested positive since the outbreak began. Good news is that of those, 11,224 have recovered, but there are currently 1,479 confirmed active cases of COVID-19 here in Tulsa County. The sad news that we get to every week is that since our last press conference last Thursday, 5 more Tulsa County residents have died from COVID-19, bringing the total to 128 lives lost through this pandemic. You know, we're constantly saying keep these individuals and their families in your prayers and your thoughts, and let's continue to do that. The more we support each other, the more we'll be able to get through this. So, talking about data trends, I'd like to provide an overview from our data team that covers the week of August 16th through the 22nd. We saw a modest decrease in cases compared to the previous week, and as you recall, the previous week we saw a decrease as well. That decrease was 5.63%. Let's just keep this decrease going. It's definitely the direction that we want to see. Largest increase in cases are within age groups of 5 to 17, with a growth of over 41% in that demographic. The age group with the most cases continues to be the 18 to 35 group that we've talked about in the past, and also again followed by the 36 to 49-year-old age group. 46.1% of all cases are in the ages 35 and younger, and only 12% are cases in the age group 65 and older. Within the high-risk settings, after long-term care and nursing homes, schools had the second most number of associated cases. Some good news, this is the first time, of course, in weeks that we continue to see no hospitalization in that 0 to 4 age group, and frankly, the first time in the 5 to 17 age group as well. So that is good news, and let's continue to keep those demographics safe. 21.4% of all hospitalizations are those in the 35 years of age and younger. City of Tulsa represents about 65% of all cases in Tulsa County. For the portion of Broken Arrow within Tulsa County, cases represent about 14% of all cases, and for the portion of Bixby that's in Tulsa County, they represent about 5% of all the reported cases in our county. And all other municipalities within our county have less than 5% of our cases. As many of you know, the White House Coronavirus Task Force has prepared a state report with public health recommendations. The Oklahoma State Department of Health provided this document to THD this week, and I've shared it with City of Tulsa and with Tulsa County. I've been asked, of course, what does this mean for Tulsa County? And I can tell you that as a county, we have implemented many of the measures that you might see in this report. However, basically, some of them are really outside our scope of control. What I can encourage is following the 3 W's: wear your mask, wash your hands, watch your distance. And this applies, of course, to everyone at all times when they're out in the public. Just yesterday, me and my team visited with the members of the Maricopa County Public Health Department in Phoenix, Arizona, and they were able to document that 14 days following a countywide mask mandate, their cases started to decline. They actually said that that was the number one thing they did to mitigate spread and to flatten the curve in Maricopa County. I absolutely recommend that Tulsa County do the same. I have seen growing evidence of the effects of cities with mask mandates versus cities without, and the data shows that cases are slowing in cities with mask mandate. And together as a county, we can all do this. We need all of our municipalities here in Tulsa County in unison to agree to do this as well, to keep their community safe, to make sure that we're all going in one direction when it comes to this response. We support Tulsa County restaurant owners and managers who have also made inside dining modifications, have expanded outside dining. You know, we really appreciate Tulsa County retail owners and personal service businesses who have made modifications to protect employees and customers. I mean, people have been forced to create a COVID business model, and they've done a really nice job of serving the public and keeping the public safe. Our food protection services continues to provide feedback to your business's health and safety plans and can answer any questions that you might have regarding your specific facility. We are glad to see signage on the doors of a restaurant that encourages diners to wear a mask when not eating to protect other diners and staff. But we also want to make sure you're looking at the back of your house procedures and what your employees are doing when they're not out in the dining room to make sure that they continue to follow the 3 W's to keep everyone safe. What we know about this virus is that prolonged contact is where we see the most spread. And when employees are working closely with each other, we want to make sure modifications are in place to keep them safe and keep them healthy. We know people still want to live their lives and come together to celebrate occasions. We just ask together, take together safely, smaller numbers if possible. What that looks like is gathering in smaller groups, meeting outside as much as possible, wearing a mask, washing your hands frequently, and watching your distance. Those who are particularly at risk for severe complications should participate virtually. We will continue to follow trends, and if we see repeated outbreaks and gatherings, we will recommend to municipalities about issuing an event size mandate. At this juncture, we don't feel that's needed, but if we start to see a change of the curve, it's something that we will definitely discuss with city leaders. I said this many times before, and it's worth repeating. After attending a large gathering, we recommend to get tested 5 to 7 days following that exposure and stay home and away from vulnerable populations while you're awaiting your test results. If you want to be tested, of course, Tulsa Health Department can do that for you without a charge. And so at this juncture, we're able to schedule same day or next day appointments. And of course, if you do want one, that number to call is 918-582-9355. If you are exposed to a known case and you test negative, it's still important to stay home for the full duration of your 14-day quarantine, as the virus, as we've all said many times before, can develop anytime from 2 to 14 days after exposure. We continue to get questions about contact tracing, and we continue to do that. We do case notification, contact tracing, and risk assessments for every positive COVID-19 case amongst Tulsa County residents. We're working very closely with the schools as we do this as well. This team includes bilingual professionals to ensure they are meeting the need for non-English speaking individuals we contact. We have staff who speak Spanish, Burmese, and Zomi to meet the needs of our largest non-English speaking communities. Tulsa Health Department also has the ability to use a language line for translation services as needed. Contact tracing, of course, we've talked about this many times, but it's a standard public health tool, one that we've been using for years and years to mitigate spread of disease. Please help us by being forthcoming with your responses to our contact tracers when identifying exposures. Withholding information could possibly jeopardize others' safety. There's nothing wrong. There's no wrong answers here. You won't be in trouble. We just ask for you to help us to help others. One of the roles that we play in this response is providing local data. We've been accessible and transparent from the beginning. We will continue to do that. We work with businesses to help them stay open. Last thing we want to see is businesses shut down again. Our liaison officer has been doing an excellent job answering emails and phone calls with questions about recommendations for youth sports, local public and private schools, universities, local events and venues, restaurants, community organizations, and faith groups that have all requested more and more information. And we appreciate them reaching out. We appreciate having a consistency in the messages and a consistency in response to safety guidelines. Please don't hesitate to reach out to us with your questions. We are happy to review any health and safety plans that you have. I think our staff have actually gotten quite good at it and can give you the recommendations you need to function in a safe manner to keep everyone that comes in contact with your facility safe. It's been an incredibly long year. We've all had to deal with the impact and the burden of COVID-19. And in this response, frankly, we've seen the best of human nature and the worst of human nature. It's important that we, instead of fighting each other, we need to fight this virus, and we need to stay together, come together, and continue to be united so that we can beat this virus down and we are no longer in COVID era. So thank you for your time today. At this juncture, I'd like to introduce Mayor Bynum.
Thank you very much, Dr. Dart. I've had a lot of questions at the city about the White House reports. And I think, as you just heard from Dr. Dart, he has been visiting with myself, my team in the mayor's office, and a working group of city councilors every single week to talk about issues that are on the ground right now, but then also looking at outside recommendations such as these White House reports and anything that we ought to be doing. And I think when you look at those reports, as he says, there are a lot of things that are recommended in there that we're already doing. The outstanding things that you don't see in place right now would be event size limitations on gatherings. And again, as you just heard Dr. Dart say, he doesn't believe, based on the data on the ground here, that is needed. But if it is, then we will act on that. Also, the other big recommendation that they have in there that we don't have in place is around restaurants and bars. And we've talked with Dr. Dart a lot about that recommendation in particular, and his concern with that is that isn't a recommendation the White House is making just for Tulsa. That is any area that's in a red zone. Here's just a list of things that you should do. And when we look at the actual contact tracing data here in Tulsa on what's causing the spread, restaurants and bars are not causing the spread right now. And I think that's the point of Dr. Dart's comment just a moment ago about the effective measures that our responsible restaurant and bar operators here in Tulsa have put in place. That's not to say that every single one of them has been responsible, but most of them have. And because of that, they are not one of the leading causes of spread here in Tulsa, like you might see in other cities that would be characterized as red zones around the country. So we'll continue to monitor this as we have from the beginning. Any of the orders that we've put in place, whether it's my executive orders or the mask ordinance put in place jointly with the city council, we've always done that based on what we've heard from our local experts here in Tulsa at the Tulsa Health Department and in our health systems here in Tulsa. Of course, we're always listening to and getting feedback from other groups around the state and around the country. But when it comes down to it, when we decide what's best for Tulsa, we're talking with the Tulsa Health Department and our hospitals, and we'll continue to do that. I told you last week about a new program that we have been made available for city employees, because we want to make sure as school goes back into session, especially with virtual school in place, we want to make sure that our employees on our team at the city of Tulsa who may not have daytime childcare options do. And so we created a student support camp program, thanks to the team at the Tulsa Parks Department, that allows employees to send their kids to a camp. The kids are kept in pods of about 10, and they have an adult supervisor for the day, Wi-Fi access, so that they can do all their virtual learning in groups in a safe environment. We've had that available for city employees. The really good news is that we have enough capacity. We can open that up for the public at this point. And so if folks are interested in enrolling their kids in this program, they can go to tulsaparks.org and sign up. I want to reiterate and be very clear. These are not teachers that are in the room with kids, but they are adult supervisors and aides. We also need more of those to help with this, both for the kids of just everyday Tulsans, but also for our team at the city. And I always get questions during this about what can we do to help our first responders. This is a great one that you can do to help your first responders so they can be focused on doing their job and keeping Tulsa safe instead of worrying about where their kid is going to spend their day. And so if you'd like to help out with that and be paid for it, you can sign up or give us a call, the Tulsa Parks Department, at 918-596-7275. These are temporary positions, and they pay $12 an hour, and they will go, everybody goes through a background check, and this is going to go into at least December. Of course, just in keeping with the theme of 2020, we're now going to start dealing with hurricanes as well, because that's pretty much one of the only things on the list that we haven't had to deal with this year. I'm really grateful that we have our team at the City of Tulsa and the Tulsa Police Department, Tulsa Fire Department are being deployed to go assist our neighbors in neighboring states And to share more about that and the county-wide effort on this, I'd like to introduce the Director of the Tulsa Area Emergency Management Agency, Joe Kralichek.
Thank you, Mayor. In anticipation of landfall of Hurricane Laura, the state of Louisiana activated the Emergency Management Assistance Compact between the states and requested assistance from the state of Oklahoma. In response, yesterday, resources from the Tulsa Urban Search and Rescue Team, consisting of 38 firefighters and equipment, left to assist with hurricane operations in southwestern Louisiana, and they have arrived today. This is going to be under the coordination and assistance with the Oklahoma State Department of Emergency Management, and we're appreciative of their efforts down there. Today, the state of Louisiana requested helicopter search and rescue teams, and Tulsa is going to be answering that call as well with the support of teams from Tulsa Fire. Tulsa Police IMT is on site at the Baton Rouge EOC, and they are assisting with coordination of evacuee transport shelter operations, and they will be helping rehome those individuals once the hurricane has passed. I want to reiterate that while our thoughts and prayers are with those that are being impacted by the hurricane, that this is in no way going to impact our readiness or ability locally to respond to any potential disasters, such as storms, floods, or anything else that Mother Nature may throw at us. And the team is in regular communications with our teams down in the area, and we look forward to their safe return. Thank you.
High school football starts for some tomorrow. Do you have any guidance on fans in the stands or teams, what they need to be doing?
The question was on high school football, which starts very soon, and do we have any guidance for teams or fans? And definitely, if you're going to have a football game, you really need to limit occupancy in the stands to no more than 25%, so you can be assured of what normal occupancy is, so you can be assured of the ability to watch the 3 Ws. And really, with the teams themselves, I mean, it's going to be really difficult because with the physical nature of football, people are hitting each other. Usually, when people get hit hard, of course, there's saliva usually expelled, so it's a risk. So it's important that they be as safe as possible on the field. They can't wear masks, they can't watch their distance, but they're really going to have to pay attention to hygiene on the sidelines as well, whether it be hand sanitizer or hand washing stations, so that they hopefully will be part of stopping spread as opposed to furthering spread. So we'll see how that goes.
In the beginning, you mentioned, if I'm not mistaken, that long-term care facilities are #1 for spread in Tulsa County, and #2 are schools. Can you walk us through a little bit more about the main causes of spread right now, if they aren't restaurants and bars and that sort of deal?
So the question was around what's the main causes of spread, and of course long-term care. We've had cases in long-term care really since the beginning, and it's a closed environment. I think the long-term care facilities have done a great job with implementing infection control protocol. But this is an opportunistic virus, and any opportunity it has to hitchhike from one person to the next, it's going to take advantage of. So we really want them to continue to follow their infection control protocol. If they hadn't, we'd be seeing much worse evidence of spread in these facilities. So they are doing a really nice job. But like I say, this is a highly efficient transmitting virus that takes, if you give it a slight opportunity, it's going to transmit. And with schools, the same thing. We've really asking the schools, and schools are trying very hard to do whatever they can, I think, to protect faculty, students, and staff. And they're going to be in the classroom. They're trying to change their footprint in their infrastructure to assure they can follow the 3 Ws around distance and masking and washing hands. And as I say, we have these recommendations, but they're not perfect. So it's important that as much as we can, we really stick to those recommendations. The more we do, the more mitigation we'll see happen.
What are the differences between the coronavirus White House document red zones and the state's red zones? There seems to be a little bit of confusion in terms of both of those maps.
So the question about the difference between the state's version of red zone and the White House documents version of red zone, and I think that's part of really what is adding to that confusion and what recommendation you follow, because right now the state's alert system has us in an orange level, whereas the feds have us in a red level, and frankly, that's one of the reasons why we pay such close attention to the local data and the data that we manage on the ground. Because it's still the state and federal government. I mean, they're a support system, but we have to act based on what we see here, and the data really guides us on what to do here and informs our strategy here, and we follow the data extremely closely. So, regardless of these alert zones, we're going to follow the data here. And as I said earlier, if the data tells us we need to do something differently, we'll do something differently to prevent mitigation and stop spread. Now, does that mean we follow everything that comes down from different levels of government? No. I think the important level to really pay attention to is our local leaders, the data here on the local level, and making the right decisions based on the data that we collect and analyze.
So where's the CDC getting their numbers from to indicate that we're in a red zone?
They look at all the state's data, so it's how you present it. So, and the question is, where does the CDC getting their data? And they get it from the states.
And so why would there be a difference between the state and then the CDC if they're getting it from the state?
And so the question is why the difference? And in all honesty, that's a question I think you need to ask the state. And I'm not evading the question. It's just it's not our alert system. So.
Kind of piggybacking off that, so the state has come out to say that they're working on kind of implementing some alterations to their COVID-19 alert system and using more regional hospital data as opposed to statewide data. And I know in the past you've said statewide data has been unhelpful. What sort of data would you want from the state, hospital-wise, to make better informed decisions for yourself or for Oklahomans to make better decisions themselves? What type of data and how often would you want to see that, daily, weekly, hourly?
So the question about the hospital data and how often do we get it? We have access to it every day. It's just how you interpret it and really how you use it, because I mean they're interpreting what it means. I mean it is what it is, but it's how you use it is what matters. And if you want to have an alert system, we said before that and I'm glad the state's doing it. I think that's great because it's a more valid reflection of what we're seeing. If you use regional data, then we at least know what the capacity for hospitalization is here in our region. If we use statewide data, the capacity here is almost irrelevant when you're talking about we're okay because there might be open beds in some other part of the state. So it's important that we look from a regional perspective. That's what affects us locally, and that's what we're talking about, capacity and capability of serving patients in our region. So, we have the data. We try and interpret it in a way that makes the most sense. And using a regional format will allow us to do that and to communicate the proper information to local leaders and to the public as well.
On the CDC and confusion, they recommended earlier this week that you do not get tested if you've been exposed but aren't showing symptoms. Are you still following the old, if you are exposed, just get tested anyway?
So the question is about the new recommendation that came out Monday about not testing asymptomatic people who've been exposed. And the good thing about that recommendation is that in it says, but still follow the recommendation of your provider or your local public health, state and local public health systems. We will continue to recommend that if you're exposed, whether asymptomatic or not, you be tested 5 to 7 days after that exposure. It's important that we detect those who can transmit. And because that's how we stop spread. And if we don't do that, the spread will be unmitigated. So we're going to continue to follow the recommendation of you're exposed, you be tested, and until we grind this virus into the dust.
Talking about your safety plan certification, how your staff's getting pretty good at that. I was wondering if you could kind of help us out and walk through some numbers, like how many businesses you've done or events and that kind of thing, what kind of response.
And Corey, I have to provide the question about how many plans have we reviewed, and frankly, I don't know. I got staff that know, and actually they actually gave an update on Monday, but I was on a different call, so I wasn't in the room. But I can find that out for you and get that back to you. I think they're doing a really nice job. We're given originally 2 weeks once we receive the plan to get information out. We're trying to do it the same week. And so most plans have been reviewed. I think we have maybe only 2 or 3 in the queue, which of course could change 5 minutes from now. But It's like you know how this you decide what you want to do as far as keeping people safe. You develop a template and then you just follow the guidelines, and pretty soon you get really good at knowing what guideline will fit specific the footprint of the business that's for the safety plan, and hopefully make recommendations that's specific to that facility that aren't general.
Are flu shots available? Have you all released your flu plan yet?
The question about our flu shots available and not yet. We're actually working on our plan. And we do this every year, and this time every year. We have our orders in to receive the vaccine and hoping to start actually administering flu vaccine in October.
Have you thought about limiting bar hours? I know you're not leaning towards closure, but have you thought about maybe closing them at 11 or earlier?
We've discussed that. I believe Oklahoma City did do that. We've talked about that, but to date, the recommendation from the health department has been that you don't want to be putting in restrictions on businesses that adversely impact them if those businesses aren't a significant contributor to the spread of the virus in our community. And so early on, in the early going of the pandemic, when we didn't have local data to know what would be causing the spread, we had to take action based on national best practices. But now we've got, we're going on 5 to 6 months of localized data, and that allows the Tulsa Health Department to make recommendations to policymakers like myself and the City Council, hopefully my neighbors in other states as well, or other cities, that allow us to make those decisions that really target those things that are causing spread. All right.
Well, I've got nobody else. I wanted to ask one more. Kind of wanted to ask you this on election night, but a lot of people have said that you are facing choices where no one's going to be happy one way or the other. How do you balance that moving forward, especially with the pandemic? Some people are for masks, some people against masks, that kind of thing. How do you balance that choice?
Yeah, no, the question is about how it's been pointed out that as mayor in this environment, I have to make decisions where the decision that I make isn't going to make anybody happy. The choices that are presented are sort of lose-lose choices from a popularity standpoint. And that's accurate. I mean, the mask ordinance is a really good example of that. You have a group of folks locally who felt like we didn't act soon enough, even though we acted when the Tulsa Health Department, our healthcare systems told us that we should act. And then there are others who say that we never should have acted at all. And my answer to that, as far as what we're going to continue to do, is that going through this is not about popularity. It's about following the advice of the experts that we have, and when we have the ability to follow that advice and follow through on it, to do so. And I'm, again, really grateful that we have a city council that feels the same way and has proven that with their votes when they were, 7 of the 9 up for re-election in a tough year, and passions are inflamed, and yet they cast a very courageous vote. To date, the only city council in Tulsa County to have the courage to do that. So I'm going to continue to do that as mayor. I've been very open that this is my last term as mayor. I won't be seeking a third. I'd also be shocked if you ever see my name on a ballot for anything. And so everything that I'm going to do, whether it's in response to this or anything else over the next 4 years, is solely going to be based on what I think is best for my fellow Tulsans. And that's it.
Hey, Ryan, I just have a quick question. What was your initial reaction to the White House document that did come out when Governor Stitt said there wasn't really anything to report, but after going back and looking through it, suggestions for a statewide mask mandate? What were your initial thoughts when you looked over that report?
Well, I had seen the initial one that was leaked and didn't know that if it was a legit document or not. I'll tell you, the The real surprise for me was when I was in the meeting with Dr. Burks and she said, and this was on a Sunday, oh, hey, tomorrow we're going to issue the 8th one of these reports to come out. To find out that, that wasn't just a single solitary report, but that there had been 7 already issued and an 8th one was coming out the next day. That was a surprise. I'm appreciative that the state and the governor's office has started publishing those online so that, in particular, the team at the Tulsa Health Department has access to these recommendations and can assess those recommendations based on the data on the ground moving forward.
Have you made any changes or alterations based on that document now that you've been able to see 8 weeks of them? Have you changed your thought process or anything that's been implemented at this point in time or not implemented?
I mean, we've had a lot of discussion in particular around the restaurants and bars and event limitations. And on each of those, Dr. Dart's recommendation to us has been that's a broad sweeping recommendation that may be applicable in some cities where they're in the red zone, but it doesn't apply to the data that we see on the ground here. The other thing that he's brought up out of that report, which I wholeheartedly agree with, is the need for a broader mask mandate than just a handful of cities around the state doing it. Our hospitals here in Tulsa do not just serve people that live in the city of Tulsa. They serve people that live in this entire part of the state of Oklahoma. And I think that when our first and foremost concern is protecting the capacity of those hospitals to save lives, it shouldn't just be on the citizens of Tulsa to protect that capacity. So I would hope, and by the way, I've said it before, I'll say it again. I recognize that the governor, he's got to weigh regulations that impact somebody that lives in a densely populated apartment building in Tulsa and somebody that lives by themselves on a 500-acre ranch in the Panhandle. At the same time, the state and the governor earlier on in this pandemic did issue regulations that localized it to counties that saw a spread. I believe his early order on takeout, which really didn't apply here because we were already doing it, but also to closure of non-critical infrastructure businesses in those counties that had evidence of spread. That was a really good way to break it out into those areas where it was applicable and not be putting a regulatory burden on those areas that didn't see or feel the presence of a threat yet. And so, that could be an option if neighboring communities around here just won't do it. That's another person who would be the governor through that kind of an action. But I feel like everything we're hearing from Dr. Dart is in the city of Tulsa, the city council and I, we're doing everything that we should be doing based on the health department's analysis of the data on the ground.
And that's actually what I want to follow up and ask you about. Given the coronavirus White House task force reports, given the state data in those reports, given local data from Dr. Dart and Tulsa Health, when you put it all together, how would you describe to Tulsans where we're at right now in this pandemic and what things are like?
Well, I really think that, the way I've put it, I feel like we're in the early stages of the 3rd phase of this pandemic. The first one was when it was brand new, and we had to take aggressive action to slow the spread of it so that our healthcare system wouldn't collapse. The second wave of it, or phase of it, was with the states reopening. And, I thought we handled that very well for about 4 weeks and not so well for about 6 weeks. And then I think recovered and recalibrated. And I said at the outset of that phase that we haven't really been through this before, and we would have to navigate that as a community. And I think we learned a lot through that second phase. And now we're in this 3rd phase when schools are starting to reopen. And, I had somebody, a state official, put it to me this way, that, this is like having a a super spreader event every single day in almost every community around the state of Oklahoma. And that presents a tremendous amount of risk. And how each individual school handles that is going to determine what kind of an impact it has on our overall caseload. So I think that right now we're in that third phase. I think we have a really good system set up at the city of Tulsa for interfacing with the Tulsa Health Department. I would say that the big lesson, if I were to be candid, from phase 2 for me is that we have to keep our hands on the steering wheel here in Tulsa. We can't rely on anybody else to be making the decisions for us. We've got to be focused on doing it here in Tulsa, working with the health department and with our healthcare system to manage it to the best of our ability here in Tulsa. Something I thought we did very well in phase 1. We realized we should have been doing a better job of it in phase 2, and I think we are doing a good job of it now in phase 3. All right. Thank you.
With what you've seen with the pandemic and a hurricane, has anything changed in how you rescue someone in the middle of a pandemic that these crews are having to deal with now?
A lot of time,
Pretty much just, we're gonna save your life and deal with the illness later.
you're asking how has this changed search and rescue operations? A lot of times our search and rescue operations were already taking into account, potential infectious diseases. And so, we would of course already have personal protective equipment for all those responders working out in the field. So if anything, all this has done is reiterated the importance and need for the training and use of that PPE amongst our response community. Of course, in this type of situation, social distancing is not available. You can't really social distance from somebody you're trying to save. And so we do have protocols in place for whenever those individuals return. We'll be working with the fire department and the police department to make sure that anybody who was out in the field doing search and rescue, when they come back, will go through a period of isolation and testing just to make sure that they're safe before they're released back into the general community.
All right, thanks everyone.
Thank you.